Good morning world, good morning Asia, good morning Philippines, good morning Luzon, good morning Laguna, good morning Santa Rosa, good morning Starside, good morning Dalton, and good day, Miss Maria po, Christina Walang Extra Miranda.
Good afternoon. We'll report hair and nails disorders. So, first is alopecia. It is the loss or thinning of the hair or yung parang pagka-bald, pagka-panot, o diba? There are two types of alopecia, scarring and non-scarring. Yung scarring, yung follicles ng hair mo is parang sira na talaga yung hindi na siya gumanon. Tapos, dun sa non-scarring naman, nagus na siya. And then, wait lang, dun sa scarring pala is may sugat. And then, sa non-scarring is like, pag nakita mo, clear siya. Like, smooth, ano lang siya, smooth spot. So, ang signs and symptoms. Sa non-scarring, may hair loss all over or circular area. So, makikita po mamaya yun sa picture. Makapabilog yung ano, pagkatanggal ng hair. Broken hairs, so sira. Smooth scalp, yung kakasabi ko nga lang kanina, at inflammation. Tapos sa scarring naman, inflammation at the edge and follicle loss towards the center of lesions. Violet colored skin abnormality. So, I think skin talaga siya natin nagsisimula. And then, ang scaly. So, ang causes ng alopecia ay skin disorders, autoimmunity, iron deficiency, so yung pagkakulang ng iron, at severe stress. So, ito po yung examples ng alopecia. So, yan nga yung sinasabi ko sa inyo yung sugat na parang pinagmumula. Tapos sa non-scarring naman is panot talaga. As in, panot na smooth. Yeah.
So, yung susunod naman po sa report namin ay ang hirsutism. Yung hirsutism po ay yung abnormal growth of hair on a person's face and body, especially on women. Ayun yung parang yung kung saan-saan tumutubo yung buhok, yan, kung saan-saan talaga. Parang pag titignan mo siya, parang siyang abnormal tingnan kasi lalo na pag sa mga babae. Kung saan-saan tumutubo, dito, isa kung saan-saan. Next. Yung sa signs and symptoms naman ng hirsutism, irregular menstruation, ayun yung kunyari, once every 2 months, once every 3 months, once a year, pwede. Next, lack of ovulation. Yung sunod naman yung acne, medyo halata naman. Deepening voice and balding. Ngayon yung susunod naman yun sa mga examples. Yan. Kung saan nga tumutubo. Parang dito, at dito. Ayan, so, ilan na yan sa mga examples ng hirsutism.
So, ang next naman is hypertrichosis. It is an excessive hair growth over and above the normal for the age, sex, race of an individual. In contrast to hirsutism, it can develop all over the body or can be isolated to small patches. So, yun nga, excessive hair growth siya na sobra-sobra na dun sa normal. So, there are two different types of hypertrichosis. It is the generalized hypertrichosis and localized hypertrichosis. Yung generalized hypertrichosis is yung pag-grow ng hair all over the body, yung buong katawan talaga, excessive yung hair growth. Tapos yung localized is patches lang siya sa iba't ibang parte lang, hindi lahat. And there's also two classes of hypertrichosis with a variety of subtypes on each class. The two main classes are acquired hypertrichosis, which happens after birth, and congenital hypertrichosis. This is because of a defect that has been present since they were born or as a result of a congenital defect and is a rare class. So, example po ito ng acquired hypertrichosis. Then, makikita din yung hair growth dito na hindi normal. Subtypes ng congenital hypertrichosis. Congenital hypertrichosis lanuginosa. This is a very rare
syndrome with only about 50 cases reported worldwide since the Middle Ages, characterized by excessive hair growth on late childhood birth. And most of the body is covered with lanugo hair, which continues to grow, and this excessively long, fine hair persists throughout life. So, lanugo hair, yun yung hair na soft and fine na makikita sa mga newborn babies. And after ng birth, pag nag-grow sila, nawawala rin yung lanugo hair. So, example po. Congenital hypertrichosis terminalis involves all over body hair growth, but the hair is fully pigmented, terminal hair, and the condition is almost always associated with gingival hyperplasia or teeth defects. People with congenital hypertrichosis are often referred to as wolfmen, werewolves, and cavemen. And back in the 19th century, they are crowd growers at sideshow acts. So, sila naman yung may growth sa all over the body na terminal hair. Terminal hair yung hair na na thick, long, tapos dark. So, ito po yun. Kaya sila nagiging crowd growers kasi nga kakaiba sila kasi nga puno yung buong katawan nila ng hair. Kaya rin tinawag silang werewolves and cavemen. So, shock defects. Common and can indicate an underlying pathology. Evaluation of hair samples under light microscopy can reveal the distinct pattern of injury and thereby facilitate an accurate diagnosis. So, hair shaft defects naman ito. Parang may sugat siya. Tapos, sabi nga sa dito, may pattern pagka na injury sa. So, fractures of the hair shaft. So, trichorrhexis nodosa, a defect which can be a result of hair processing or congenital. The cuticle surrounding and protecting the hair fails to form correctly or is near to chemical activation, which destroys the protective layer resulting in hair breakage. So, dahil nga daw sa chemical sub-process, yung cuticle, yung parang covering ng hair na nade-destroy po yung layer na nagpro-protect sa mismo. And tricholasis, sometimes referred to as green stick hair. This hair shaft defect causes a thin break across the hair. So, dun po sa shaft ng hair, may hiwa po dun na tawag na dito green stick hair. Similar to tricholasis, presenting a split break across the hair shaft due to the absence of the hair cuticle. So, yung kaibahan nyo naman po din sa tricholasis is yung sa trichosis naman po. Ganun din po siya, may break din po siya sa hair, kaso wala po yung hair cuticle. Pilitor, aka trichochinesis, presents as spiraling hair like a corkscrew. This hair shaft defect may present a shimmering effect. So, malinaw naman po siguro yung meaning ng pilitor na yung hair po may shimmering effect. Split ends, hair-rich splits from the distal end leading to hair loss at skin level if fractal width. So, siguro naman po, ito po siguro yung pinaka-common na hair shaft na fracture, yung split ends po na halos lahat po ng babae siguro na-experience na ng split ends. Then, irregularities of the hair shaft, yung pili multi-gemini hair follicles or compound hairs is said to be a condition that results in multi-hair shafts being produced from a single hair follicle. So, dun daw po sa hair follicle, nagkakaroon daw po ng more than one hair shaft. Then, pili, describes the hair shaft effect that presents a slight and dark bands along the edges. Tends to be more apparent in blonde hair and dark hair than in past this condition. So, dito naman po, yung hair naman daw po, parang nag-change yung color ng hair shaft na mas which may contain water when hair is wet. This condition may result in hair breakage. Uncombable hair syndrome, also known as spun glass hair, both of which describe the hair fiber itself. Then, whisker hair presents as an irregular band extending around the edge of the scalp from the ears to the armpit. This form of hair shaft defect affects those from adolescents producing quicker neck hairs. Yan po yung examples po ng nilang hair shaft defects.
Onychotrophia. Onychotrophia is an atrophy of wasting away of the nail plate which causes it to lose its luster, become smaller and sometimes shed entirely. Injury or disease may account for this irregularity.
So, yon, yung onychotrophia, yun yung parang unti-unting pagbabawas ng kuko sa kamay or sa paa, or minsan, dahil sa paunti-unti niyang pagbabawas ng kuko, nauubos na yung kuko. So, yun.
Fungal infection. Fungal or yeast infection which results in onychomycosis can invade through a tear in the proximal and lateral nail folds as well as the eponychium. This type of infection is characterized by onycholysis with evident debris under the nail plate. It normally appears white or yellowish in color and may also change the texture and shape of the nail. The fungus digests the keratin protein of which the nail plate is comprised.
So, yun, yung fungal infection sa kuko, dahil yun sa isang, sa mga fungi, ganon. So, papasok siya galing dun sa mga cracks sa nails natin. Tapos yun, tapos may makikita na lang kayo na parang may liquid sa loob na parang yellow yung color. Tapos yun, ang ibig sabihin, tapos yun, parang kinakain niya yung keratin galing dun sa nails natin, na kaya nagiging parang brittle yung nails natin. Kasi dun gawa yung nails natin.
Onychorexis are brittle nails which often split vertically, peel, and or have vertical ridges. This irregularity can be the result of heredity, the use of strong solvents in the workplace or the home, including household cleaning solutions. Although oil or paraffin treatments will rehydrate the nail plate, one may wish to confer with a physician to rule out disease.
So, onychorexis, yun yung magsisimula siya sa parang isang baak lang, tapos unti-unti nang mababaak yung kuko mo. Tapos, kadalasan siyang nanggagaling sa paggamit ng parang strong or parang dangerous na mga solvents sa bahay. Tapos, pwede siyang mamana. Yun.
Tinea yung buwis or ringworm of the nail is characterized by nail thickening, deformity, and eventually results in a nail plate loss. This is another symptom of Candida yeast infection.
So, itong Tinea unguis, ito yung ringworm sa kuko sa Tagalog po eh. Tapos yung daliri, kakapal siya pero nade-deform yung itsura niya. Yun.
Euconesia. Euconesia is evident as white lines or spots in the nail plate and may be caused by tiny bubbles of air that are trapped in the nail plate layers due to trauma. This condition may be hereditary and no treatment is required as the spots will grow out with the nail plate.
So, ayun, ito yung Euconesia. Ito yung puti-puti sa kuko natin. Ganito. Ito. Ganyan. Ito. Ayan.
Ayan.
Yan yung pinaka-common sa lahat ng pinakita namin disorder sa nail na halos lahat yata meron tayo. Tapos, pwede siyang hereditary. Hereditary. Tapos, hindi siya walang treatment sa kanya kasi sa mismong kuko, sa labas siya na nakikita.
Psoriasis. Psoriasis of the nails is characterized by raw, scaly skin and is sometimes confused with eczema. When it attacks the nail plate, it will leave it pitted, dry, and it will often crumble. The plate may separate from the nail bed and may also appear red, orange, or brown with red spots in the lunula. Do not attempt salon treatments on a client with nail psoriasis. Consult with a dermatologist for diagnosis and treatment.
So, yun. Yung psoriasis, para siyang
di ba yung nails nyo, parang humihiwalay siya dun sa mismong finger nyo. Parang natatanggal yung dikit niya doon. Tapos nagiging nagiging dry siya. Tapos nagka-crumble siya. So, parang nagiging brittle siya. Kaya, yun, nagka-crack-crack. Tapos yun, pag nagkaroon kayo ng ganun, wag na kayong pumunta pa sa salon. Dumiretso na kayo sa derma para gumaling na siya. Yun na.
Views lines are nails that are characterized by horizontal lines of darkened cells and linear depressions. Disease or dirt may be caused by trauma, illness, malnutrition, or any major metabolic condition, chemotherapy, or other damaging event, and is the result of any interruption in the protein formation of the nail plate. Seek a physician diagnosis.
So yun nga yung views lines. Yun yung horizontal line na dark, na medyo dark yung part. Tapos, yun yung cause ng inflammation ng protein sa nail plate. Tapos, yun din yung, it may be the cause or effect ng trauma natin or metabolic condition.
Pterygium is the inward advance of skin over the nail plate, usually the result of trauma to the matrix due to a surgical procedure or by a deep cut to the nail plate. Pterygium results in the loss of the nail plate due to the development of scar tissue. Cortisone is used to prevent the advancement of scar tissue. Never attempt to remove pterygium. Instead, consult a physician for advance and treatment.
Yun, yung pterygium is the inward of skin. Makikita niyo naman sa picture na parang kulang yung sa nail plate niya, di ba? So yun yung, ang cause nito ay yung surgical procedure or deep cut to the nail plate. Tapos, it may also result, dahil kasi nakikita nyo dito sa picture, resulta niya ay loss of nail plate. Tapos, sinabi rin dito na hindi pwedeng gamutin ng nail technician lang basta yung sakit nito, kailangan ay physician talaga.
Coverage of the quiz 1A, 2L, 3L. Goodbye, Dalton.